This is providing catheter care. For this skill, you will need a bath blanket, gloves, towel, washcloths, and a bed protector, as well as your water, of course. I will knock on the door, identify and greet the resident, indicate that you'll look at the armband. Good morning, Miss Bobby. My name's C. I'm your nursing assistant today, and I'll be cleaning your catheter. She says, okay. I have to get her consent. Then I will wash my hands and provide for privacy. I'll collect my supplies, bring them into the room. Then I'll need to raise the rails and raise the bed to a comfortable working height. And raise the bed. And lower the rail on the side I'm working. Okay. We need our bath blanket. The blanket is folded into quarters, so you never fan linen, it spreads microbes. The closed fold is on the edge of the bed with a loose quarter on top. The first quarter comes off. The other 3 quarters go across. Then I'll ask her to hold the bath blanket, and since it's a mannequin, I'll tuck it under her shoulders. Then I'll pull down the linen. Now I'll put on my gloves. And put the bed protector under her to protect her bed. And the cloth side goes against the patient, the rough side goes against the bed. I'll turn her away from me to place the pad under her. Now she's lying on the pad. Then I will position her for catheter care. I already have my warm water, my washcloths, and my towels. I'll pull up the bath blanket. I want to leave the corners down and try to keep her legs covered, just to provide as much privacy as possible. And I'll ask her to let her legs fall to the side. Keep her legs covered if you can. Then I want to get my washcloth, put them both in the water, make a mitt, wet, put on your soap, and then as if you were doing perineal care, you'll clean around one side of the catheter, down the other side, and with the center of the with the washcloth, hold the catheter in place and wash down the catheter at least 4 inches. I'll get my separate washcloth to rinse. Make a mitt, clean down one side, clean down the other side, hold the catheter in place, and rinse. I will pat the area dry. Then I want to make sure the catheter is secure to her leg so it doesn't pull. I want to make sure it's coiled on the bed so it doesn't kink. If it kinks, it's not going to flow, and it'll cause the bladder to get too full and the urine will get stagnant. You always want to hang your bag on the movable part of the frame, not the solid part, because if this comes up, you want the bag to come with it, so it doesn't pull on the catheter. Need to remove the pad. This goes in the dirty linen. Take off my gloves. Those go in the trash. Bring up her linen. Take off her bath blanket. That goes in the dirty linen. Raise the rail. Lower the bed back to a comfortable height for her. Lower both rails. Okay. Then I will make sure she can reach her caul light. I will take out my dirty linen and clean up my mess, wash my hands, and report any concerns.